I do want women to know that there is an alternative to suppressing their bodies with hormones, that they can see their body as a good and they can live in that body holistically.
Totally. Oh my gosh, it's amazing.
Join co-hosts Jamie Rathjen and Teresa Kenney as they educate women about the beauty of the feminine design and empower women to take charge of their health.
They're going to be so amazing. You're going to be so empowered by understanding your feminine genius and your hormone genius. I don't think I could live my whole life knowing this and not sharing it with anyone. Hey everyone, and welcome to the Hormone Genius Podcast. Today we are here to interview Star Edwards. Star Edwards has her Master's of Science. She's an RDN, an LD in healthcare. She's a practice director, and I know Star with her involvement from Tiny Health, because Tiny Health, you know when you're on Instagram, Star and Teresa and our listeners, and like an ad pops up or something just pops up at you, and it's because you've been searching the things. I'm pretty sure that's what happened with Tiny Health, because I don't know of any other context of how I would have come to learn about Tiny Health besides my own search engine. So I stumbled upon Tiny Health, learned about this gut testing company, blown away. I had my son do a gut test. It was so easy and simple. And the dashboard of the outcomes and the lifestyle recommendations, all of it was just incredible. So I got on a call with Star for Fiat Institute, and she did some work with me with Fiat Institute and all of this. And I just really came to enjoy you, Star. And so I wanted to have you on our show so you could share with our listeners all about the importance of gut testing, but also why it's important to have proper gut testing and maybe some things to think about, especially as women, you know, our vaginal microbiome. We don't hear much about that. So we'll get into a bunch of things. But Star, I want to welcome you to our show, and I can't wait for our listeners to learn more about you and your work and also Tiny Health.
Oh, thank you, Jamie. And thank you, Jamie and Teresa, for having me. I think we've had some really good conversations so far, especially around our kids. And it just seems like we have a lot of similar ground there. So I'm excited to be here and pull that conversation in and share it with everyone.
Yeah, it's awesome. And, you know, one of the big things that caught my attention with Tiny Health is this idea of, you know, even at the earliest of ages, to understand what the gut microbiome is important. And how as pregnant women, you know, our health really does, and our delivery and all of this really does impact the gut microbiome of our newborns. And so that's what I think is so interesting, Star, about Tiny Health, is that, you know, they kind of picked up on the need of kind of the newborn era and the need for that. So share a little bit with our listeners. What is Tiny Health? What makes it unique? And then let's get into what gut testing even is.
Yeah, so Tiny Health, I call the unicorn on the market. We're the unicorn gut test. We test for all ages and stages of life, for adults too. But we were the first testing company really built for the first 1,000 days of life, and really for under the age of 5. There's not really any testing companies out there currently that have metrics and reference ranges specific to those age groups. So what I mean by metrics are specific things that we're looking at in the gut microbiome. The microbiome of a pediatric, I was going to say patient, but pediatric client, pediatric person under the age of 5 is so different than an adult. And we need to be looking at those differences with a test that's built specifically for them, and not utilizing tests that are based off of adults and then trying to, you know, in our head, figure out how to make that relevant or work for someone that's under the age of 5. So yeah, our company was built by our founder, Cheryl Sohoy, who had a C-section birth, and the baby ended up having some atopic March symptoms, food allergies, eczema. And she did a lot of research and found that there are papers out there in PubMed that talk about the connection between C-section and atopic March. And her second child was born at home, vaginally, none of these issues. So that really got her thinking about this and looking on the market for a way to test her baby, and there wasn't a test. So that's how we were built. But of course, our science team has the metrics and reference ranges for every age and stage of life. You mentioned pregnancy, and we do work a lot with fertility and pregnant moms, both with our gut health test and our vaginal health test. It's extremely important to prime those microbiomes for baby's birth. However, one area that I'm very passionate about that I don't think we talk enough about is how the mom's gut microbiome impacts baby's development in utero. This is fascinating to me because the microbes in mom's gut produces these metabolites. So if I were to break this down a little bit, we eat food. We're feeding different microbes in our microbiome depending on what we're eating. Basically, healthy microbes like healthy diet. So things like starches and fibers, whereas your more disruptive pathogenic microbes tend to like more of the standard American diet. Go figure. But after these microbes take in these foods from our diet, then they produce something. It's like this little factory inside of us. So if we have healthy microbes and we're eating healthy foods, they're producing healthy byproducts like short chain fatty acids. On the other hand, if we're eating unhealthy foods and we have unhealthy microbes, they're producing toxins like something that we call lipopolysaccharide, LPS. Now, when we're pregnant, those things actually do cross through the gut into circulation. They cross the placenta. Some of them actually cross the blood-brain barrier of the baby. These things act as epigenetic modifiers. So depending on if you have a toxin there or something healthy like a short-chain fatty acid, that can change your epigenetics either positively or negatively. And this will impact overall neurodevelopment, immune development, genetics. So it's so important during this time period to think about our gut as mom and how that is influencing baby's growth and development. I could go a million different directions here, but I will pause there.
Yeah, that was a lot of information. I'm sure people are like, whoa, head swimming. So I kind of want to go back to, in a sense, the basics of this. So these tests generally are not tests that are offered at regular doctor's offices. There's also, I think our audience is probably aware of, gut testing. You hear about it. Maybe people hear about the GI map, I think is more kind of a more popular test. I do want you to explain Tiny Health and the technology of gut testing, why we don't offer this in regular doctor's offices, and also what is the difference between a Tiny Health test and something like a GI map or a comprehensive stool analysis, if there's any difference.
Yeah, great question. And we do have several different ways for people to access this test. One is through functional medicine doctors. One, you can purchase it your own, which I'm sure on your own. We'll talk about that later. But yeah, regular conventional doctors don't typically do microbiome testing in their office, primarily because it's not seen as diagnostic. It's a wellness test. We're trying to change the landscape in that regard, maybe not making it diagnostic, but understanding how important it is to your overall health. And our goal and our vision is for every pediatrician to be doing these tests as part of a wellness screen or development screen early in life. We really think it should be a part of conventional medicine, considering that it can have such a profound impact on babies' development. And we recently published a research study showing that in C-section born babies, using our test and our recommendations decreased the odds of atopic March by 83%. So some fantastic research coming out of this. But yeah, what's different about it and something like a GI map? The same types of doctors that are using GI map are going to be using our test, except that, we have the pediatric arm of that as well. One of the things you mentioned is technology. We are using a different type of technology. And the type of technology that we're using is called whole genome sequencing. And it's really good at seeing the overall ecosystem of the microbiome. So what we can do is give you all of the microbes that are there. If there are 500 microbes in your microbiome, you're going to see all 500 of them. That can be a little overwhelming, so we do divide it up into categories that make a little bit more sense. We also, with this type of technology, which is something else I'm fascinated with, is we can look at the functions. So when I talked about the byproducts or the metabolites of these microbes, what they're doing, we can look at the genes of these microbes to see what the genetic capacity of these microbes are doing. Do they have the genetic capacity to help you digest your food or produce things like short chain fatty acids or gases like hydrogen sulfide that can make you bloat up? We look at different metabolites that can impact your brain health, for example. So we're not just looking at who's there, which it's good to know who's there, but we're looking at what they can actually do, how they're going to impact your health based off of their function.
Star, this is so interesting to me. I think, for those of our listeners who are like, okay, I've heard of gut testing before, but I don't even understand the microbiome at all. Like, what is the deal? What's the deal with our gut health? What's the deal with even our gut health and hormones with the Hormone Genius podcast? Like, why does gut health matter? So let's start, like, what is the microbiome and why does gut health matter?
Yeah, we kind of jumped into the middle of the story there. So I like to set it up by talking about what we call the gut organ axis. So, and when we talk about the gut, I think it's even important to talk about what that means because I think people think of that as their stomach, but we're really talking about the colon. We have microbes all the way from our mouth, all the way down to our colon, but most of them are in the colon, and that's where they have the biggest impact. So that's where the gut microbiome is. And we have now the gut microbiome is so important for us. It's like this army that's just doing all these jobs and taking care of us. And we don't think about the fact that we really need to protect and support this army. While we know so much about the gut microbiome right now, there's so much we don't know. So we say we can't micromanage our microbiome. And that's one of the reasons I love our test and how it looks at the overall ecology of the microbiome. You don't want to get too specific as far as thinking about one microbe and just trying to be sharpshooters and how do I get this one thing up? How do I get this one thing down? There are definitely exceptions to that. But we want to support the overall ecology of our microbiome with the foods that we eat, with our lifestyle, because right now in the world we live in, we are exposed to so many different things that negatively impact our microbiome that we didn't have to think about years ago. Our diet, for one, stress, medications. In the past, our ancestors may have been exposed, but they may have taken a hit on their microbiome, but they would go back out into nature and they would eat healthy and their microbiome would bounce back. But we don't live like that anymore. So when we have this healthy microbiome, then it impacts, besides just the metabolites that it's producing, it really is impacting and helping to support healthy inflammation levels in your body. So the gut organ axis means all the extra intestinal, I love this word, extra intestinal organs in your body. The gut impacts them. So we're not just talking about GI symptoms. We're talking about skin issues. We're talking about hormones. We're talking about your liver, your brain, anxiety, depression. Your microbiome plays a role in the health of all of those different organs. So when we are supporting our microbiome, we're supporting our overall body's health. On the other hand, if we don't support our microbiome and we're exposed to some of these gut disrupting factors, then that can play a role in the symptoms and the conditions that we encounter.
I think it's so frustrating. Again, we talk about this a lot on the podcast is, I don't know, as good as you can possibly even eat, you are exposed to things that are still affecting your gut lining in a negative way. And I think, again, everybody's like trying to search for this balance of how crazy do I got to go, in terms of lifestyle and all the things in order to really get healing. That's probably a bigger, larger topic. But I do want to ask, because I think this is what people really are fascinated by is parasites. My first question about parasites and something like a tiny health test, because I see that it's supposed to pick up parasites. I mean, how many of us have parasites? I often say to my patients, like, in a lot of ways, I think we all are full of parasites. Because we have a microbiome and it has trillions of bacteria and viruses and funguses and things. So think we're all a host in a sense to parasites. But obviously, when we're talking about trillions of bacteria, we're talking about an ecology, like you said, and what's supposed to be there in the right balance and what's not supposed to be there. So, do you know how often we see parasites that are truly kind of pathogenic in these types of tests? And then, if you have a parasite, like, what is your advice to people? Is it just, especially if these people are buying tests on their own? Like, are you just giving them a little protocol? Do they have to see a healthcare professional? I don't know. Just, I think people are really interested in, do I have parasites?
You're right. There is definitely a fascination with parasites and people taking cleanses and taking pictures of their poop and look what I found and showing it. So, yes, there's a fascination with that. And being on the receiving end of those photos sometimes, I'm like, I did not ask for that. Okay. Yeah, I think there's a few different things here. And one is that it is trendy, I think. So, yes, we have parasites, but maybe it's one of those things we've taken a little bit too far, and everyone thinks they have a parasite. Therefore, I should go out and do a cleanse. And I do feel like you need to work with a qualified healthcare provider, functional medicine doctor to first of all test, because I'm not a huge fan of just doing these serious cleanses without knowing and assuming if you have some type of symptom, just assuming it's a parasite. What if it's not? What if it could be candida? You could have SIBO. There could be all these other things that need different treatments. We look at protist. We do not measure helminths, which means those roundworms, tapeworms, any kind of worms that you can see with your naked eye are helminths. We do not measure those. They're a little bit too large for the type of technology that we are using. But yes, we look at protist. So things like blastocysts, hominis, for example, giardia, not that uncommon. I mean, we don't see it a lot, but we definitely see it show up. There's even some research that's showing small levels of these things are beneficial for the immune system, which would make a little bit of sense because, again, going back to our ancestors, we coexisted with these things. So in low levels, they can serve us in some purposes. But again, I feel like that's completely up to your personal healthcare provider to determine if it's something that needs to be treated.
Mm. That is true. I do feel like there is like a pesticide frenzy. I feel like it's been like a couple years even.
Yeah.
You know, maybe during COVID, people started thinking like,
Parasite, Jamie. Do you know what you said?
What did I say?
You said pesticide.
Oh,
Pesticide frenzy, which there is
That's also a problem.
right?
pesticides are problems.
Yeah.
Maybe that's a transition point. Yeah.
Yeah.
Like what's all being sprayed on our food. Oh my gosh, parasite, pesticide. That's hilarious. Okay, well, speaking of pesticides, Star, and thinking of just the quality of food. So far we talked about what makes tiny health testing different, and it's the type of technology, it's the span, like the lifespan. So there's reference ranges and marks for even the newborn, even the newest borns of babies. But in terms of like simple, easy things to help with gut health, what are some tips and things that we should stay away from? And what are some foods that, or even lifestyle exercises, lifestyle practices that we should incorporate to empower and to encourage gut health?
Great question. And we were talking about diet earlier. Diet is really the biggest determinant of your microbiome. It helps to shape your microbiome. So we want, honestly, if I were to boil it down to one thing that would be easier for everyone to follow, it would be the Mediterranean diet. There's been lots of research on the gut microbiome specifically in the Mediterranean diet. And overall, it's just the best for the microbiome. Your omega-3 fatty acids, which are rich in healthy fish, for example, they help to support your microbiome, not only with inflammation, but they act as a prebiotic, which is something that feeds your beneficial microbes. Of course, lots of plants and fiber-rich food, moderate in protein, want to go more towards the healthier protein, healthier fats are very important. On the other hand, standard American diet is the worst for the gut microbiome. So just working on your diet and taking it in small steps. You don't have to overhaul your diet completely, but I've seen cases where just making a few dietary shifts after 6 months pre and post tests has completely turned the microbiome around. So diet's a big one. Medications, of course, we have to have medications sometimes, but making sure that you really need that medication before you ask for it, take it. Of course, follow your healthcare provider's advice, but even over-the-counter medications. If you're taking a lot of medications because of over-the-counters for GI issues, get to the root. Why are you having those GI issues? Don't just keep taking antacids for the rest of your life. There's a reason. There's something going on there, and you need to solve that because those antacids are horrible on your gut microbiome. So I guess that answers both what's the best and the worst for your gut microbiome, but it's your standard controlling stress, digestion. I'm huge on digestion. If it's not food, it's digestion is my motto. The gut bacteria kind of get whatever's left over. If your digestive system isn't doing a good job, your gut microbes have to deal with it. And if you're not digesting your proteins and fats well, then that's going to end up feeding those disruptive microbes in your microbiome. So you really need to focus on slowing down. As moms and women, this is really hard for me to sit down and focus on my food and to chew it slowly and enjoy it, but it is so important for your digestion.
Okay, I have one more follow-up question, Star. So you mentioned medications. I've recently been on an antibiotic, which sucks. I'm so mad. I needed to. It's so frustrating for me, because I'm thinking, how long is it going to take to repair my gut? And if I were to take a tiny health test, would my antibiotic throw off the results? Like, how often do we take a test? What throws it off and might give it a faulty reading, if that's even a thing? So can you give us information on that?
Yeah, the only thing that could possibly give it a faulty reading is that sometimes we recommend that you don't take the test while you're on probiotics. And this is more of an issue with babies than it is with adults, but there is the chance that perhaps you take that probiotic and it could cluster up in the sample. And then when you sample, we need such a tiny amount, which is something that's different than with our test. It's such a tiny amount of sample that you need. It's super easy to do at home. But if you happen to poke that one spot that was probiotics, then that could cause an issue. But that rarely happens, and it's mostly in babies. Other than that, if you are on a short course of antibiotics or steroids or some other medication, I recommend waiting for maybe 1 to 2 weeks until after you're done, because you want to see how it has impacted your microbiome. So yes, if you have to take antibiotics, we have to do it sometimes. But we do have these tools now, like the stool testing, that can tell you what it did to your microbiome. And we have wonderful therapeutics that you can use too to help it bounce back. Also, being mindful that while you're on antibiotics, there is research showing that if you eat fiber-rich, plant-rich foods during that period, it protects your microbiome and actually decreases the damage to the beneficial microbes. So when you're sick, try to get a smoothie or shake in. It's not always the first thing we want to eat when we're sick and taking antibiotics, but it really can go a long way.
So I want to ask a little bit more about probiotics here in a second, but I want to take a break and talk about nutrition a little bit more by mentioning our podcast sponsor, We Heart Nutrition. And We Heart Nutrition has incredible supplements, really high quality, third-party testing, family owned. They just really care about the quality of their products and what you're really getting in taking We Heart Nutrition. I was just this week in my office, and one of my nurse practitioners was talking about offering the Wholesome Balance supplement from We Heart to their premenstrual syndrome patients. Why? Because this nurse practitioner actually herself has been taking Wholesome Balance for 3 months and her PMS is gone. And so she's been recommending it to patients. So Wholesome Balance has saffron in it. It's super good for anxiety and hormone balancing, and there's clinical research on that. So we want you to check out We Heart Nutrition. You can get 20% off your first order with the code GENIUS, GENIUS, weheartnutrition.com, code GENIUS. So Star, with probiotics, and I think I was kind of watching some videos about Tiny Health. I think in your test results, you kind of offer some suggestions sometimes on supporting the microbiome, like you've got this amount of these types of bacterias. We need more of these bacterias in your gut in order to make that balance, you could say. What is like, is there specific probiotics that you think are better? Like is it truly you're giving, because a lot of times they take a probiotic, right? What? Go to Walgreens, grab it off the shelf. What? You know what I mean? Like, So give us like, what is really the lowdown on probiotics and how do you guys offer that advice?
Yeah, with probiotics, I'm a firm believer that you get what you pay for. So don't buy the cheap probiotic. It's a waste. You're just throwing money down the trash can. And that is one of the benefits of doing a microbiome test. You have no clue. People ask me all the time, what probiotics should I take? I don't know unless I know what's going on inside your microbiome. So that is one of the benefits of taking the test is to see which microbes you need to support. And we're not just looking at, oh, you're low in bifido, so take a bifido. We're also looking at their functions again. So you may have higher gas producing microbes, and there might be specific probiotics that have shown to help with things like those symptoms. So we take that into consideration too. And yes, on the Tiny Health test, it comes with what we call an action plan, and it will provide specific supplement options, recommendations, along with lifestyle and diet recommendations based off of what we find in your results. So, not everyone's action plan is the same. We are really pulling in that information from what is on your test results, as well as what our clinical and science team has vetted, and as far as supplements and probiotics specifically.
That was one thing that I loved about getting those results back, specifically for my son, is it made it very clear. It even, I think for my son especially, to get tests like further testing for SIBO. They're like check SIBO, and I thought, man, I'm so thankful, because there were symptoms of that I thought like kind of bad breath and all these things that kind of smelled a certain way. I thought interesting. So it really did point us in a direction of further help. And what's interesting is that I love the doctor we go to, but they felt so unequipped that we were referenced or referred down to a bigger hospital system about an hour away to help with that. And I would have never done that on my own. I wouldn't have asked that question. So it really is important and very, very helpful. So Star, we talked about, again, kind of the basics of gut testing, importance of gut health, but now let's bring more into the light of hormone health. So how does gut health impact hormone health for women?
Great question. And there's several different ways, but one way is through something called beta glucuronidase. It's a big word, but it's an enzyme. And I explain enzymes as scissors. So enzymes cut things apart in your body that are bound up, it cuts them apart. So beta glucuronidase is an enzyme that's produced by our gut bacteria. And when we have estrogen, for example, that is bound up, so it goes to the liver and the liver conjugates it or binds it up, makes it inactive. So then that estrogen is inactive, and the purpose of that is to excrete it. But in the process, it has to go through the gut microbiome to be excreted. When it gets to the gut microbiome, then these microbes produce this beta glucuronidase that can go in and snip that conjugated piece apart and free up the estrogen. So it basically reactivates it. Now, this is helpful in balancing estrogen levels. But if we have a lot of pathogens, unfriendly microbes, they produce more beta glucuronidase, and it can cause high levels of estrogen because we're recycling too much estrogen. On the other hand, this happens especially as we go through perimenopause and menopause and estrogen levels start to drop. We're producing less beta glucuronidase. When it's too low, we may not have enough estrogen, and that can result in some of the symptoms that we experience.
So then what is the way, if that is the enzyme, like, is that something you could just add back in? Let's just say someone is super low in beta glucuronidase. How do you get more?
Yeah, great question. We often see it, I guess I should say we see it more often high than we do low, but definitely we see it low. And it's a catch-22 because it is the disruptive pathogens that are producing more beta glucuronidase. However, what I've noticed is that women who are trying to eat extremely healthy and they're eating low calorie, low fat diets, their beta glucuronidase tends to be too low. So what we usually do is work on diet and have them increase diversity overall of the gut microbiome. So sometimes more fibers, more plant foods, but also adding back some healthy fats and healthy protein will usually do the trick.
So I want to move on to kind of like the full microbiome. In a sense, like you mentioned it earlier, a microbiome goes from, the start of our mouth all the way to the anus. But I also know that in a sense, our microbiome kind of like moves over into the vaginal area too. I mean, there's just this very deep connection between the colon, the gut, and everything, and then our vaginas. And I know Tiny Health has a test for the vaginal microbiome. I think people will be very interested in that. And I've noticed even my own patients, even though I can offer them actually super awesome, really good PCR testing in the vagina, they'll go and get these, online tests that look at the whole microbiome as well. And I know you mentioned that in relationship even to fertility and the health of pregnancy. And so give us a little overview of the vaginal microbiome and kind of really why this also is so important in terms of kind of the full aspect of gut health, even though it's not exactly the gut.
Yeah, there is this cross-sectional, I guess, bidirectional relationship between the gut microbiome and the vaginal microbiome. If you think about it, just the proximity of the two, whatever is happening in your gut microbiome is going to end up in your vaginal microbiome and influence the microbiome there. And they both, they influence hormone levels, and there's this crosstalk there as well. But the vaginal microbiome is basically the opposite of the gut microbiome. Whereas in the gut microbiome, we want lots of diversity, high numbers. In the vaginal microbiome, we want very little diversity, mostly lactobacillus. People probably think of lactobacillus as being a gut microbe, but in adulthood, it's not as important. It's more important in the vaginal microbiome. And in the vaginal microbiome, it helps to increase the acidity, which kills off pathogens. It produces hydrogen peroxide, which kills off pathogens. Interestingly, lactobacillus follows estrogen. Estrogen will initiate glycogen, which is lactobacillus's food. So when estrogen rises in puberty, then lactobacillus rises. Throughout the reproductive years, we want mostly lactobacillus. And then as we start to go through menopause, we lose that lactobacillus and it leads to dysbiosis. Anytime you have less lactobacillus, you're going to have more pathogens. That will lead to things like BV. It will lead to yeast infections. BV doubles the risk of miscarriage in the first trimester. So when we're talking about fertility, there's this fascinating story of a guy I talked to that he was a provider, but he had been working with a zoo with these white rhinos, and he had done our test. So I was talking to him about this, but in these white rhinos, they were infertile. They couldn't figure out why they weren't getting pregnant and carrying to term anymore. And he did some vaginal microbiome testing on them and figured out that they had dysbiotic vaginal microbiomes, fixed it, and they started having babies. So I love to tell that story because the benefit of these tests isn't that we're just looking for pathogens. You can look for specific organisms. You can know you have an infection. You can try to treat the infection. But unless you see the overall ecosystem and know if you have enough of the beneficials like lactobacillus, you're going to continue to have problems. It's just as important to support that lactobacillus as it is to decrease the pathogens.
Super interesting. I love that rhino story. So if a woman has dysbiosis of her vaginal microbiome, we talked about with our gut, we increase our fibers and we I'm sure also hydrate, keep stress low, all these things that we can take care of our gut. But how do we take care of our vaginal microbiome?
Some of the risk factors of getting dysbiosis or having dysbiosis are the same as the gut, like diet, medications, anything that increases inflammation. Feminine hygiene products can also create some dysbiosis as well. There are some things, sexual activity will increase dysbiosis as well. Some of these things are a part of normal life. So it is important just to test, especially when we're having symptoms and to support the vaginal microbiome. We can be more careful about some of the things that we do, but overall, we just need to stay on top of it. And there are probiotics that you can take both orally and vaginally. It can be as easy as taking an oral probiotic that can support the vaginal microbiome. Some other tips and tricks. But as we go through menopause, it's important to support, especially as estrogen drops. You can do things like hyaluronic acid suppositories. You can use vitamin C suppositories to keep the acidity down since we have less lactobacillus. It's just lactobacillus is the most important thing, and you want to think about how to support it.
And I think that's really important that, there are specific probiotics that are like with those strains of lactobacillus that
Hmm.
even the strains that are particularly in the vagina. I know Jarrow has some of those
Hmm.
probiotics. I
Yep.
know there's others as well, but that's really important. And it makes me think, and I wanted to bring this up earlier, is I often tell my patients, like all of these bacteria in a sense are probably present in our bodies, like even the bad ones, right? They're there. They're not like colonized heavily. And so we don't
Hmm.
feel the effects of it. But these little guys are opportunistic, so
Yes.
opportunistic that even if you treat, even if I have a patient with really bad bacterial vaginosis and I treat it all it takes is for something to upset again the the microbiome by whether it be stress or intercourse or the diet. They traveled. I mean, there's just so many things. And all of a sudden they're back. They're like, Teresa, I don't understand. You just treated this 2 months ago and it's back. And I said, well, yeah, we treat it, but really we're never getting fully rid of it. Like
Hmm.
you aren't fully, even with antibiotics, which are amazing for, killing off things, they don't always fully get rid of everything. And then you're just waiting for something for these little guys to become opportunistic in back in your body again. So it's why it's so important to understand what your triggers are. So and it's also important to make sure that people find the ways that they can prevent these infections from coming back. I have my patients use boric acid suppositories, also a way to keep some of those like offending bacteria out and lower the pH. But even vaginal probiotics, I've had people have good success keeping and warding off things by using vaginal probiotics too. So that's just my kind of take on it. But as we start to wrap up, I just want you, Star, to be able to share any other incredible stories, maybe that really show how impactful doing this type of tiny health gut testing can be on someone's life.
Yeah, I think the most in fact impactful really are on those pediatric patients and especially the first 1,000 days. Jamie and I have talked a little bit about my story and my son who during the first 1,000 days, he was exposed to a lot of probiotics and went on to develop some neurological concerns, developmental delays, and I strongly believe that if I had this testing and this knowledge back then, it wouldn't have happened. So that is why one of the reasons that I've got a fire under me and I'm passionate about this. So I love looking at tests and working with our parents of pregnant women and parents of little ones because I've seen it completely turn around the trajectory. You can just see one of the first tests. We start testing as young as 7 days old. We recommend around 4 weeks. But you can see during that first test if maybe mom had group B strep, for example. This happens a lot. Maybe it is a C-section birth, but it doesn't have to be. It could be other gut disrupting factors like group B strep, and mom was given antibiotics during birth. That does the same thing. It decreases her bifidobacteria and lactobacillus. So baby isn't colonized with those things. And in babies, bifidobacteria is the most important thing. So you can see these tests and just see that there's no bifidobacteria, which means we're probably going to end up with atopic march, food allergies, eczema. And we see all these LPS high, all these inflammatory markers really high. And then we use that information to give them a very short course of targeted probiotics. Now, in babies, you can completely change the microbiome in just a few weeks of probiotics. They colonize it so well. In adults, not the same thing. But just a few weeks of these probiotics and working on breastfeeding, which, by the way, if mom does not have bifidobacteria in her gut, she won't have as much bifidobacteria in her breast milk. Therefore, baby's not getting bifidobacteria. Important to note. But on repeat testing, we generally recommend repeat testing in a few months. So during the first year of life, we want to do about 3 tests. And on that second test, we see bifidobacteria being perfect, all these disruptives and LPS being at healthy, normal levels. And this is really encouraging for moms and parents who are worried about a family history of food allergies, for example, or ADHD, autism, and just being able to be a part of that and see how we potentially helped to stop that from happening is amazing. I'm starting to tear up as I
No.
talk about
Hmm.
it. Yeah.
Star, thank you so much for sharing that. And it is just a beautiful thing, especially I think there's this like mama bear something in us women when something happens to our kids, you know,
Mhm. Yep.
or we find that there's a way to serve another family or another mom who
Mhm.
could potentially go through the struggle that we've gone through. We will do everything we can to help
Yep.
serve that mom for sure.
Yep.
And that's what's happening, I think, here with you, Star,
Mhm.
is you have that desire, which is so important. So hopefully our listeners are getting a sense that again, tiny health is worth pursuing for you, for your family. If you're pregnant, please take the test. Once you have your baby, please test the stool. I mean, you would be amazed. And again, I think this is just the beginning, Star, of this kind of revolution. We've gut health has been on, the landscape of conversation, it feels like for years. But it's newer. It's this idea of gut health is newer as it impacts our health. And I hope it will just become more and more prevalent. And maybe someday it will be commonplace for a pediatric appointment and they check the stool, they send the stool in to see what that gut health is like. So I want to make sure our listeners know if you're interested in getting a tiny health test, you will get $50 off with the code Hormone Genius. So if you visit tinyhealth.com and use Hormone Genius, you will get $50 off of your test. Again, something that I love so much about this idea of gut testing is that if everything seems to be going well in your life in terms of your behavior, your lifestyle, but something still isn't working quite right, maybe your mood is still off, or you have skin condition or whatever, but you're doing everything right, but you haven't checked your gut microbiome, please consider this. This is like a stone you can turn over easily. So again, be sure to check out tinyhealth.com, type Hormone Genius for $50 off. Okay, with that, Star, as we wrap up, I'm going to ask you the question I ask every interviewee. What do you wish every woman knew about her hormone genius?
I think to work with your hormones, like I know it's annoying that for women they shift and they change, but it's meant to be that way as long as we're optimizing them and that we do have some control over the process as well. And as long as we take care of our health and look at the root cause and focus on helping to support our hormones, then they will support us.
Also, Star, just as we wrap up too, I just want you to make sure everybody knows everything about Tiny Health in terms of the social media handles. Again, repeat the website, anything else you want to share about information about Tiny Health gut testing.
Yeah, so anyone can order a test from us at tinyhealth.com and learn more about us. If you happen to be a healthcare practitioner, we have another website called poweredbytiny.com where you can sign up to get Tiny Health for your practice. And we also offer what we call our Pro Gut Health Test only to qualified health practitioners. So if you are a practitioner, then check that out. It includes stool chemistries. If you do order off of tinyhealth.com, then it comes with support, a group call, or if you do a membership, a one-on-one call to have one of our coaches walk you through the results and help you choose your probiotics and other recommendations out of your action plan. We are on Instagram, we're on LinkedIn, Facebook, I believe. So you can find us everywhere.
Yeah, it was easy. I don't think that's a common name for anything, Tiny Health. So it was easy to search out on Google just kind of how to get to your websites and stuff. So that's awesome. I also want to remind everybody, Jamie and I have our perimenopause program that just came out in this last month. If you go to hormonegenius.com, it'll show up right at the top of our website. It is an incredible, really health-based lifestyle pillars that will change the course of your perimenopause to menopause and really the rest of your life. So please check that out. There's an incredible amount of hormone information in there and exercise information, nutrition information, a lot of stuff. So we want you to check out that too. I'm going to thank our guest today again, Star Edwards from tinyhealth.com and Tiny Health Gut Health Testing. We really appreciated the conversation. You're going to hear more from us about Tiny Health over the next few months. So thanks so much, Star.
Thank you.
Thanks for listening to the Hormone Genius Podcast. Please remember to share our podcast with your friends and family, and also follow us on social media. If you were not aware, we have a YouTube channel, so if you could like and subscribe to our YouTube channel to stay in the loop with all of our latest episodes, we would appreciate that. Thank you so much for your support. We are excited to journey alongside you as you discover the beauty and the genius of your hormones.